Welcome to This Explainer. Today, we're exploring one of the most awe-inspiring, complex, and absolutely vital systems in your entire body, human respiration. Right now, literally, without you even having to think about it, your body is performing a miraculous mechanical feat. It's taking in life-sustaining oxygen and expelling waste. But how exactly does this delicate system work? What happens when it comes under attack? And maybe most importantly, how resilient is it when it comes to healing? Well, we're going to unpack the whole shebang, the anatomy, the injury, and the recovery of your lungs. Here's our itinerary for today's micro journey. We're covering 1. The power of your breath. 2. Journey of a single breath. 3. The enemies of your lungs. 4. Inside a damaged lung. 5. Can your lungs heal? And finally 6. Protecting your vital breath. We'll be moving from anatomy to pathology and then straight into actionable solutions. So let's jump right in. Section 1. The power of your breath. Okay, let's dive into this. Right where you're sitting, take a slow, deep breath in and feel your chest expand. Go ahead, really feel it. That is your diaphragm at work. It's a large, powerful muscle right below your lungs that physically moves downward to pull air in and then moves upward to push it right back out. Now, to really appreciate the sheer power of this system, we have to talk scale. A healthy adult breathes about 12 to 20 times every single minute. When you add that up over a 24-hour period, your lungs process an absolutely staggering volume of air. We're talking up to 20,000 liters every single day. To put that into perspective, that's enough to fill a small hot air balloon day in and day out without fail for your entire life. It is just an astonishing mechanical achievement. But you know, that macro-level volume, that's really only half the story. The real magic happens at the microscopic level. Inside your chest, right now, you have up to 500 million microscopic air sacs working tirelessly. These tiny sacs are called alveoli, and let me tell you, they are the true unsung heroes of your respiratory system. Because there are so many of these alveoli, their combined surface area is totally mind-blowing. If you were to somehow flatten out all 500 million of those tiny air sacs, they would cover an area roughly the size of a tennis court. Think about that. An entire tennis court's worth of surface area folded up and neatly packed inside your chest. It's designed that way to maximize contact with the air you breathe, so your body can extract as much oxygen as humanly possible. Section 2, Journey of a Single Breath. To really understand how that massive surface area is utilized, it helps to visualize your respiratory system as an upside-down tree. The trunk is up at your throat, and the branches spread downward, deep into your chest. Let's move to and see how this builds, following the actual path of a breath. It all starts at the nose and mouth. They act as your first line of defense, using these tiny hairs to trap dust and germs while warming and moistening the incoming air. From there, the air travels down the trunk of our upside-down tree. That's the trachea, or windpipe. The trachea then splits into the right and left bronchus, which divide again and again into thousands of smaller tubes known as bronchioles. Finally, at the very ends of those tiny branches, the air hits its final destination, the alveoli. Now, what's really interesting about this is what actually happens when the air arrives. The walls of the alveoli are incredibly thin, and they're wrapped in this super tight network of tiny blood vessels called capillaries. This, right here, is the crucial site of gas exchange. Oxygen simply slips right through the thin walls of the alveoli directly into the blood, where your heart pumps it to every single cell in your body for energy. At the exact same time, carbon dioxide, which is just waste gas from the cells, moves from the blood back into the alveoli so you can exhale it. Section 3, the enemies of your lungs. This whole system is incredibly elegant, for sure. But because it relies on such delicate tissues, it is extremely vulnerable to external threats. We really need to look at what happens when this delicate, upside-down tree comes under siege. The reality is, your lungs face a pretty intense gauntlet of threats every single day. Behaviorally, vaping causes severe irritation and airway inflammation. Environmentally, breathing vehicle exhaust or factory smoke over the years can trigger asthma or COPD. And even in the workplace, hidden dangers like occupational dusts, stuff like silica, coal, cotton, or asbestos can quietly cause severe long-term diseases. Add in severe respiratory infections like pneumonia or COVID-19 that can leave scarring, or toxic chemical exposures like chlorine, and you start to see just how much abuse this tissue takes on a regular basis. But among all of these threats, smoking remains the absolute biggest cause of lung damage. It's the primary villain here. Cigarettes introduce thousands of harmful chemicals directly into that delicate alveoli network we just talked about. We're talking tar, carbon monoxide, formaldehyde, benzene, heavy metals, the works. This massive toxic load directly causes damaged air sacs, chronic bronchitis, emphysema, lung cancer, and severely reduced oxygen levels in the body. Section 4. Inside a damaged lung. So we know the external threats, but what is physically happening inside your chest when those threats actually take hold? Let's zoom in and look closely at the internal mechanical damage. And this brilliantly illustrates the stark, brutal contrast between a healthy system and a damaged one. Healthy alveoli look like tiny, stretchy balloons. They're pink, soft, completely elastic, and highly flexible. They effortlessly expand and shrink with every single breath. But on the flip side, when damaged, these tiny balloons completely lose their elasticity. They become swollen, they fill with mucus, and they can even physically break apart. When they get stiff and rigid like this, they can no longer exchange oxygen efficiently, basically starving your body of the energy it desperately needs. Now, if this injury happens repeatedly over time, the lung tissue forms scar tissue. This is a condition known as fibrosis. Remember how we said the lungs need to be elastic to easily expand with the downward pull of your diaphragm? Well, scarred lungs become incredibly stiff. When the lungs are stiff, they resist expansion. That means your breathing muscles have to work significantly harder just to pull in a single breath. Section 5. Can your lungs heal? I know, looking closely at that damage can feel a bit overwhelming. So the natural question to ask next is, can this vital organ actually bounce back? Can your lungs heal from all this? The answer is a hopeful yes, but it is highly dependent on the severity of the damage. The truth is, our lungs are remarkably resilient. If the damage is mild, say a temporary inflammation, a mild infection, or the effects of early smoking, the lungs can often completely repair themselves over a period of weeks to months. If the damage is moderate, like a bad bout of pneumonia, recovery can take months to years. And honestly, it might not be a 100% complete recovery. However, we have to be realistic about the limits of regeneration. Severe damage, like advanced fibrosis, emphysema, or extensive destruction of the alveoli, is permanent. The body simply cannot regenerate large numbers of destroyed air sacs once they're gone. Looking at the data, there is a very clear dividing line here. With timely treatment, things like pneumonia, mild airway inflammation, and even tuberculosis, when treated with a full, complete course of medication, are often totally curable or reversible. But diseases that involve permanent structural damage, like COPD, pulmonary fibrosis, and advanced emphysema, fall into a completely different category. These can certainly be managed to slow their progression, relieve symptoms, and improve your quality of life, but they cannot be completely cured. Section 6. Protecting your vital breath. Because some of this damage cannot be reversed, prevention really is everything. So let's move into the final, highly actionable part of our explainer and talk about the everyday steps you can actually take to maintain your respiratory health. Empowering your breathing starts with really simple daily actions. Cardio exercise, like walking or swimming, physically strengthens your breathing muscles. Meanwhile, an antioxidant-rich diet full of fruits and veggies helps your body fight off internal inflammation. Want a brilliantly simple mechanical trick? Just drink more water. It physically thins out your mucus, making it much easier to clear from your airways. You can also practice diaphragmatic breathing exercises to improve your lung efficiency. And of course, minimize those external threats we talked about. Avoid pollution, mask up in dusty environments, and stay updated on your vaccinations for influenza and pneumonia to dodge those severe infections. So the crucial point is this: eliminating the biggest threat yields the biggest reward. If you smoke, quitting is absolutely the single most effective step you can take, period. And your body's response is incredibly fast. Within just hours of stopping, the toxic carbon monoxide levels in your blood drop. Over the following weeks and months, your lung function measurably improves, your cough decreases, and your long-term risk of lung disease completely plummets. Now, as you care for your lungs, you've got to remain vigilant for the massive red flags. Do not ignore a cough that just won't quit after 3 weeks, or chest pain when you breathe. If you ever cough up blood, notice unexplained weight loss, or see blue fingertips, which indicates dangerously low oxygen, you need to seek medical help immediately. Fever combined with severe breathing difficulty is an immediate, non-negotiable call to action. Early detection is exactly what keeps a manageable issue from becoming permanent damage. Your lungs are an absolute marvel of biological engineering. I mean, think about it. An entire tennis court of delicate, life-sustaining tissue neatly folded inside your chest, pulling in enough air to fill a hot air balloon every single day just to keep you alive. They are incredibly resilient, but they're not invincible. Knowing exactly how they work and what damages them gives you the power to protect them. So as we wrap up this explainer, I want to leave you with this one lingering, vital question. What will you do today to protect your next breath? Thanks so much for joining me on this journey, and keep breathing easy.